Hi, it's John again. This time on this video, I kind of want to talk about surgery that I have coming up. So I've got, I don't know, like 56 more days or so. I will be having surgery after pretty significant weight loss, 260 pounds, and that'll take place on July 15th. What am I having done? I have a list right here of everything that's going to happen. It's going to basically be tummy tuck, fleur de lis. There'll be some work done in the chest. Armpit area will be underneath the armpit, I guess, would be done. Everything pretty much you see from, midsection all around the area will be corrected or fixed. So obviously there's a lot of extra skin from losing that kind of weight. And yeah, so there's a lot that needs to happen. So I will do some more videos on this particular topic as we get closer. Whenever I have my pre-op, I will do one for that, record most of that or as much as I can. And then the day of the surgery, I'll do one for that as well. And then after the surgery is over, and I'll do one, and probably a few months down the road, I'll do one more. Or maybe I'll just put them all together. I don't know. But that way there's kind of a before and after kind of thing. And I would need one later, a couple months down the road when the swelling is all gone and you kind of see what's left. So that's just kind of what you can expect. But as far as what it's going to look like, I did take a couple pictures today. So I'll show those of me now for the haircut today. So I'll put those here. And that's kind of what I look like without a t-shirt on. Just, have a compression shirt that I wear underneath. That's kind of what that looks like. And then what's going to happen or what they're going to do with all these surgeries. I'm going to show a couple of videos on that here. And that will kind of show me from the front and from the sides and basically what's going to happen. So from the front, you will see obviously the chest and okay, calm down. You'll see the chest, and obviously certain things will be moved up to where they're supposed to be. And then I'll be cut going down the middle, kind of in an angle, coming down towards the sides, and then below kind of your stomach area, and then all that stuff will be removed. And then everything will be kind of closed up. A big chunk of it will be taken from the front. On the bottom, beneath where your kind of midsection is, I guess your upper pelvic area, that will be lifted. And then they're also obviously doing the chest area, underneath the arms, and any extra skin around that area will be taken off. And then if you look at the pictures from the side, I'll show those as well. You can kind of see already, because I spend a lot of time working out now, lifting weights, you can kind of see where my chest like actually is from the side. It's higher than what it, really looks like if I'm wearing a shirt. So that's kind of what will be fixed there. And then I'll kind of circle underneath one of them where the skin will be removed underneath that, underneath the arms, and how, the stomach area, once that's removed, everything will just kind of go flat and go straight down. And yeah, so that's kind of what that's going to look like. I also had, with the help of AI, I did a little picture, or requested a little picture of me with the shirt, same shirt on, after these surgeries. So that should be here. That's kind of what it theoretically should look like in a perfect world. I have my expectations are not that high, but that's kind of sort of what it's going to look like. And yeah, so obviously it would be a big difference. This kind of surgery is very expensive. It's not cheap. So yeah, we'll see what that does and how I end up, and what that ends up looking like. Obviously we're going to know for sure, because once I have the surgery, I'll show pictures of before and after, and yeah, we're going to know exactly what it looks like. So there will be scars, obviously. One more picture, which I'll leave up for a brief moment, would be me, according to AI, without a shirt on, and I'll kind of put that there, and that will be just to show you where the scars are going to be. I don't expect it to be that accurate, obviously. That is not realistic, honestly. But there's going to be flaws, obviously. It's not going to be that pretty. But just to kind of show you where the scars will be, there's going to be a scar kind of going right down the middle, scar just below, your midsection, and you probably won't be able to see that one when you're, have shorts, pants on, or whatever. But the one down the middle, you're not going to be able to avoid that. That's going to be there. As far as the chest area, I'm sure there'll probably be some small scars there, but I don't really know what that's going to look like, or how that's going to turn out. So yeah, this is not something that I take lightly. I'm excited about it. I'm excited to go through it. I'm excited to be done with it, I guess you would say. Not excited to go through it. I'm pretty scared of it. So it's something I'm sure they do all the time, and tons and tons of times every day, hundreds a year, thousands, or whatever. It's probably a normal day for them, but for me, it's not. I've never had surgery. I've never been put to sleep. Never done anything like this. So yeah, it's kind of freaks me out a little bit. But after you put in the kind of time you put in to drop that kind of weight, I work out every single day for an hour, 2 hours, 2.5 hours, sometimes longer. So yeah, you put in all that work, you want to kind of see what you have, and this is going to give me an opportunity to see that. So I'll be able to lift up the hood and finally see what's under there, because right now it's like you're walking around with a blanket on all the time, and that blanket has not been taken off. Like arms, I can tell from the work I put in the gym, I can tell arms get bigger, veins start coming out. It's easy to see. My legs, easy to see, but anything in the midsection area, chest, can't really tell. Well, upper chest you can kind of tell, but right below that you can't see anything. You can't tell anything. So you don't really know, from all the work that I put in, what it looks like. So after the surgery is done, then we will know exactly what it looks like, and we'll know exactly if all the work I put in makes a big difference or not. So we will find out very, very soon, and it's less than 2 months away. And yeah, so we'll see how that turns out. Thanks for your time.